What's up YouTube, I'm Mike, and today I'm talking about estrogen again. Actually, we're going to be talking about aromatase inhibitors because there's a lot of bro science being kicked around in my comment section by people who clearly don't know what the fuck they're talking about. So, today I'm going to break down why I use, we're going to go over the 3 different aromatase inhibitors and compare and contrast them, and I'm going to explain why it is that I exclusively use Arimidex. So a lot of people have been in the comment section saying you should have used Aromasin. Some people suggest that you use Letrozole. Everybody seems to have their reasons for this. I'm afraid that most of you don't do any research to find out what it is that you're actually taking and listen to way too much bro science. So today I'm going to give you the real science of why I think Arimidex is the best drug for bodybuilders to combat estrogen-related side effects in the body. Because I am going to be explaining what I think the best drug is, let me clarify in saying that this is not medical advice. I am not a doctor. I am not telling you what you should do with your body. I'm telling you what I do with my body and why I think it is the best decision, certainly for me, and probably would benefit anyone who goes about this. So, one of the things that I was reading in the comments section is that I should have used Aromasin because it would have prevented the rebound effect of having my estrogen go from crashed to too high in a short period of time. There is some truth to that, but we're going to get to why I kind of take exception to Aromasin as why I think it's the worst drug you could use, honestly, and why I exclusively use Arimidex. So today I'm going to be reading from Wikipedia. So for those of you who like to read along, you might want to go ahead and bring up anastrozole, letrozole, and exemestane, also known as Aromasin, on Wikipedia if you would like to read along, because I am not fucking clipping it into this video. So, if we go to the pharmacology, pharmacodynamics section of the Wikipedia on anastrozole, we will see that anastrozole works by reversibly binding to the aromatase enzyme and through competitive inhibition blocks the conversion of androgens to estrogens in peripheral tissues. So, what Arimidex does is it binds to the aromatase enzyme and prevents it from then thus binding to testosterone, so it stops it from converting testosterone into estrogen, which is what we want. The other key component is that it is non-steroidal and that it reversibly binds to the receptor. One of the other key components of Arimidex is that it does not have any effect on your FSH and LH levels, which will be important in a minute. So anastrozole is going to reversibly bind to the receptor and it is going to prevent aromatase expression from taking place. It's going to prevent your testosterone from becoming estrogen. Now, another thing I often get lambasted for in the comments is people tell me that I'm taking, it's crazy. I can't believe you take 3 milligrams of Arimidex and 500 milligrams of testosterone. That's insane. That's way too much Arimidex. Why? Why exactly is that too much Arimidex? Do you even know what the fuck you were talking about when you make these statements? Is it because that's what somebody told you? Is it because you crashed your estrogen with that amount of Arimidex? What makes you think that that's too much Arimidex for me? Especially considering the fact that I've actually had blood work to confirm what my levels are. But you could also, if you wanted to, read the next line in the pharmacodynamics section of the anastrozole Wikipedia where it says, the medication has been found to achieve a 96.7 to 97.3% inhibition of aromatase at a dosage of 1 milligram per day. Holy fuck! So taking 1 milligram per day, or 7 milligrams of Arimidex per week, was enough to create a 97.3% reduction in estrogen levels. Now, this is presumably in women. So why exactly would 3 milligrams be too much for a man who aromatizes estrogen at a very high rate and is taking 500 milligrams of testosterone per week? I have regularly had higher estrogen levels than my wife. My wife is on estrogen replacement therapy trying to combat this to some degree, but even on her replacement therapy, her estrogen is lower than mine has been at times on blast. So I don't know where you guys get this data where people, it's so common that somebody's just fucking blown away by how much Arimidex I take. My body converts estrogen at a very high rate. Potentially as high as a woman. I don't know why it's so fucking high, but I could apparently be taking as many as 7 milligrams a week, depending on how much estrogen is going around in my system. And it would, but even then, sort of independent of how much estrogen or testosterone is in my system, according to this, it takes 7 milligrams per week to clog up all of the possible aromatase enzymes. So really, when you think about it, it shouldn't have anything to do with men or women. There's a finite amount of aromatase in the system, and it takes 7 milligrams to block all of that. Not even all of it, 97.3% of it. So really, it should be independent of man or woman. This is what it should take to completely clog up all of your aromatase enzymes. So, that aside, to get to the comment that somebody made, when you're taking a dosage of Arimidex, you have testosterone floating around your system, and the testosterone is total testosterone, and it is trying to go somewhere. So one of the places it can go is it could bind to the androgen receptor, it could be 5-alpha reduced into DHT, or it could be aromatized into estrogen. There's some other things I believe that can happen to it, but for the purposes of this video, that should be sufficient. So if you have total T floating around in here, and you block its conversion to estrogen to some greater or lesser degree, and then you do what I did, and you suddenly take all of the estrogen blocking drug out of the system, aromatase is immediately going to start taking this testosterone, converting it into estrogen at a very rapid rate, especially in my body, which is why I went from crashed estrogen to vomiting like a pregnant woman nearly overnight. So some people have said, well, if you had used Aromasin, this wouldn't happen. And while that is true, what is also true is that it would have taken significantly longer for me to bring my estrogen level up to normal, because Aromasin is a suicide inhibitor. So let's look at Aromasin. Aromasin, also known as exemestane, is a very, very different drug than Arimidex. So Arimidex is a non-steroidal anti-estrogen, or a non-steroidal aromatase inhibitor, and Aromasin is a steroidal aromatase inhibitor that is used in ER-positive breast cancer in addition to surgery and or radiation in postmenopausal women. So the problem with exemestane is that exemestane is an irreversible steroidal aromatase inhibitor aromatase inactivator of type 1. Structurally, Aromasin is related to the natural substrate 4-androstenedione, which is a steroid molecule. It acts as a false substrate for the aromatase enzyme and is processed to an intermediate that binds irreversibly to the active site of the enzyme, causing its inactivation, an effect also known as suicide inhibition. I believe, now this may be some bro science on my part because it doesn't specifically say it here, I believe that Aromasin can actually kick estrogen off, or it can debind what is already bound to the aromatase enzyme, but that's irrelevant. What is relevant is that it doesn't bind in a superficial way to the aromatase enzyme, whereby when you take the drug out of the system, the bond breaks and aromatase is free to go back to doing what it does. In this case, it actually binds to the receptor, to the enzyme completely, because it fools the enzyme into thinking that it is an actual substrate for aromatization. Testosterone is a substrate for aromatization, which means that the aromatase enzyme can convert testosterone into estrogen. Exemestane appears to be a substrate, and so aromatase binds to it completely, and then it just can't do what it's supposed to do. And it will stay bound until the enzyme is destroyed. So if you stop taking exemestane, you still have to wait for all of the drug that's in your system to get out, for the enzymes that have already been destroyed to clear your system, and then for new enzymes to be made and start binding to your testosterone to start bringing your estrogen levels back up through the process of aromatization. So if I had been using exemestane when I crashed my estrogen, it would have taken far longer for me to get it back up than simply taking out the Arimidex, which admittedly was not the perfect idea, but it would have taken longer for the exemestane to get out of the system because it irreversibly binds to the enzyme and effectively destroys it. It also undergoes a first pass effect in the liver. So there is some liver toxicity to exemestane, and it is a steroidal drug. So exemestane has a number of other side effects that come along with it because it's a steroid. So the most common side effects are hot flashes, sweating, which are typical of estrogen deficiency. Exemestane can also cause insomnia, headaches, joint pain. An occasional decrease in lymphocytes has been observed in 20% of patients receiving Aromasin, particularly in patients with pre-existing lymphopenia. Exemestane has androgenic properties similar to formastane and can produce androgenic side effects such as acne and weight gain. So again, there's a number of other pharmacodynamic things about exemestane, but for me the most important thing is that I want any drug that I'm taking to do something very finite and specific so that I can control all of what it's doing. I don't want it to have multiple different effects. That's one of the problems with Masteron. I just want the Masteron to make me hard and veiny and vascular, and give me a good fucking mood and great libido, and stop acting like a fucking SERM. Unfortunately, it does, and because it acts like a SERM, it causes a bunch of other problems. So if you're using exemestane, also known as Aromasin, then you are actually taking a steroid. So you're getting steroid side effects, and you're getting a suicide inhibitor that affects aromatase in a very different way than anastrozole and letrozole, which is the last one on the list that we're going to talk about. So letrozole, in my estimation, would be the second best thing to use. Arimidex is best because it just does one thing. It's just going to inhibit the conversion of testosterone into estrogen. We can very easily look at this data on blood work. We can see exactly where our hormone levels are, and we don't have an androgen in our system that could be creating other androgenic side effects on top of all of the shit that we're already taking. We also don't have suicide inhibition, so we have much more control over the amount of aromatase expression that we have taking place in our bodies. So Arimidex is best because it's the simplest, most basic, easy to dose, easy to use drug with a known quantity for completely shutting down your aromatase enzyme activity in the body. Letrozole is very similar to anastrozole in that it is a non-steroidal aromatase inhibitor. First we'll get to how it works. So letrozole is an orally active, non-steroidal, selective aromatase inhibitor, and hence is an anti-estrogen. It prevents aromatase from producing estrogens by competitively and reversibly binding to the heme of its cytochrome P450 unit. We're not even getting into hemes and cytochrome. It binds reversibly to the aromatase enzyme and prevents the enzyme from turning testosterone into estrogen. That's what we care about. And if that's all that it did, then I would say that letrozole is a very, very good drug. It is about twice as potent as Arimidex. So whereas Arimidex at 1 milligram per day knocks out 97.3% of aromatase expression, letrozole at only 0.5 milligrams per day knocks out 98.4% of aromatase expression. So this is how you can crash the fuck out of your estrogen if you take letrozole thinking that it's Arimidex. Because if you take a milligram of letrozole, it is slightly more than twice as effective as a milligram of anastrozole. So you want to be very careful you don't get those mixed up or have some fuckhead underground lab send you the wrong drug. Because letrozole will crash the fuck out of your estrogen if you use it at the same dose as you're using Arimidex. So aside from that, why do I not like letrozole? The other reason that I don't like letrozole is because letrozole is also used for ovulation induction. Letrozole has been used for ovulation induction by fertility doctors since 2001 because it has fewer side effects than clomiphene, also known as Clomid. So when a woman's trying to get pregnant, she's having some problems, one of the drugs they can give her is Clomid. When guys come off cycle and they're trying to kickstart their bodies producing their own natural testosterone again, one of the drugs that is given in PCT is called Clomid. Why do we use Clomid? For the same reason that they're using letrozole. Because Clomid and letrozole tell your brain to secrete FSH and LH. That's follicular stimulating hormone and luteinizing hormone. Those two hormones tell your testicles to start making sperm and testosterone. And so again, we have a drug that does not just reduce estrogen. We have a drug that will also have some ability to make more sperm and more testosterone by turning on FSH and LH, and these are more variables that we cannot specifically know or control for. If letrozole is making you make more testosterone, then you're making more testosterone to turn into estrogen. Now, I suspect that this is a very low amount, but because we cannot know definitively, it is a variable that I don't want to deal with. So why would I take letrozole when I can just take Arimidex and know that the only thing the drug I'm taking is doing is inhibiting aromatase expression and preventing me from growing tits and having vomiting? So these are the three drugs that we have in our arsenal. Arimidex and letrozole are both non-steroidal aromatase inhibitors. Exemestane or Aromasin is a steroidal aromatase inhibitor, and clearly the Arimidex is the best drug to use because it is the most easy to control and doesn't cause a cascade of other effects that you have to account for. If you use letrozole, you can get great results, but you have to know that it is also acting as an FSH-LH agonist, and it's going to be talking to your pituitary and your testicles to some greater or lesser degree. If you use Aromasin, then you are using a steroidal agent that has steroidal side effects and is also going to be a suicide inhibitor. It is not going to release from the aromatase enzyme. So if something should go horribly wrong, if you should crash your fucking estrogen, you're gonna have a harder time bringing yourself back out of the fucking toilet using something like Aromasin than you would if you were using anastrozole. So there you have it. That is the reason that I use Arimidex exclusively. I suspect it's probably the reason it's the #1 most prescribed anti-estrogen by just about every single TRT company I've ever come into contact with, because it is the easiest to dose, the easiest to control, and the easiest to unfuck scenarios when you fuck them up. Admittedly, I should not have stopped it cold turkey. That definitively caused a rebound, but at the end of the day, it got me back to normal very quickly, and if I had been a little bit more proactive in noticing my high E2 symptoms, I could have redosed with the letrozole, which I did already start doing, just not sufficiently enough. I could have redosed with letrozole, with Arimidex, and prevented this nightmare that I've been having for the last 3 fucking days. So where I'm at now is I'm back to injecting 500 milligrams of Test E per week with 3 milligrams of Arimidex per week. And I'm going to use the Masteron to whittle down the rest of it until we get dialed into the perfect sweet spot of nice, solid, rock-hard erections and libido and mood and vascularity and muscles and gains and pumps and confidence and self-esteem and all of the things that we're all looking for when we do these types of cycles. So there you have it. If you have any further questions or would like to argue any of these points, I'm sure somebody's going to, please leave them in the comment section below. I think I'm going to start plugging this on every video because it seems to be working. I would like to thank the new subscribers to our fan sites. I would definitely like to thank the new paying subscriber. For all of you who are browsing around for free, you are welcome to do so. I'm going to continue to post content on a daily basis, so be sure to check that out. If you need testosterone replacement therapy, please contact Royal Medical Center and they will hook you up. Use code MikeFit at sign up and you can get a discount on your first 6 months. If after listening to this video, anybody still wants coaching at a very cheap rate, I'm still rolling at $50 per month for limited access coaching. You can hit me up on Instagram for that. In fact, I have some clients that I probably need to check in with because I haven't heard from you guys in a little while. So I'm going to check in with some people who are already signed up. What else can I say? Subscribe to all the things, click bell buttons, do all the things that you know to do but won't do unless you're told to do. And as always, we'll see you on the next one.